Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, I'd like to talk about inhalers that are used for asthma attacks. So I think this is a very, very important topic. I got this comment from the greatest username that I've seen so far. So rebellious entity from hell. Okay, funny. So hello doc, question. Please can you tell me what's the most recommended inhaler to bring with you when you're having an asthma attack? So I think this is quite an important question. There are some nuances here, but just to give you the brief answer first and then the long answer afterwards. So generally people use a Ventolin inhaler. So something like this, a blue inhaler containing salbutamol. Now Ventolin is the brand name for the first inhaler that was produced in this fashion. It's a short-acting drug. So the effect can be felt within minutes, but it only lasts for a few hours. And then the effect goes away. So this is basically something that we use as a reliever only when we have an asthma attack. Some people may be on this medication a lot, but it's not usually the best way unless the asthma is really, really mild. But in any case, this is the short answer. The long answer is that there are different options of dealing with an asthma attack. So first of all, the first thing that I want to say right off the bat is it's great to be on a controlled inhaler that you take regularly to prevent asthma attacks. So the best treatment for asthma attacks is to prevent them, because once you get an asthma attack, it can be really difficult. You may be struggling to breathe during that moment in time, and your inhaler may not be as effective because you may not be able to get the medication in as well as you can. You may need to take a lot more puffs. You may get a bit of palpitations because you need to use a lot of inhaler to deal with the asthma attack. So preventing the asthma attack is the most important thing. So obviously good treatment, good inhaler technique with your controlled inhaler, whichever that one may be, there are tens available, is really good. So just using that one to prevent asthma attacks is the first step. Then, if you do get an asthma attack, despite being on good medication, it can happen. So you can be exposed to some sort of a trigger. Maybe you go out suddenly into very cold air, or you're doing some exercise that's a little bit out of proportion with what you're normally doing, or you're exposed to some allergen, something noxious in the environment, something triggers basically your asthma. You do get an asthma attack. Now, normally you would start off with something like this. So generally most patients who suffer with asthma would be prescribed a Ventolin inhaler to keep around the house, just in case they get a bad asthma attack, to use it because it's short acting, it's quite effective. Some people do not respond as well to the Ventolin. So for some people, it's not the best inhaler for some reason. It's quite rare that that's the case. In that case, there may be other inhalers that do not contain salbutamol, but they contain something called ipratropium. So the most common one would be Atrovent, that contains ipratropium. A similar style inhaler, but it's slightly different class of medication. Also short-acting, different mode of action. So that can sometimes be used for an asthma attack as well, although it's not as wide-acting. So how shall I put this? The activity is not as wide-ranging as in the case of salbutamol. But that can work sometimes. The other option is that sometimes you can find inhalers such as Combivent. They're not available throughout the world, but they can contain both salbutamol and ipratropium in the same inhaler. So it's a short-acting combination inhaler used as a reliever. Sometimes people find that quite helpful because it has a more potent effect. But again, it's not necessary for most people. So there are different options. The other thing that can be used is sometimes you may have something called a SMART strategy. So single maintenance and reliever therapy. I think that's the acronym. So basically that's when you have an inhaler such as Symbicort or Foster. So these inhalers are a combination inhaler that they contain an inhaled corticosteroid that controls the inflammation in the lungs. So it's used as a controller over time, so regularly. But they also contained a bronchodilator inside the same inhaler that acts for about 12 hours. However, because that bronchodilator is something called formoterol in both of these inhalers, this is also a rapidly acting bronchodilator. So its effect to open up the airways is relatively quick. Maybe not as quick as this one, but it's still within minutes, right? So if this one is within a couple of minutes, you will feel it. For that one, maybe it just takes 5 to 10 minutes, but it's still fairly quick. So you can use it if you're having an asthma attack. So Sometimes your doctor may only prescribe a single inhaler and they'll tell you you can use that if you get an asthma attack as well. Just take an extra puff when you get the asthma attack. But in most cases, you will have some sort of a control or medication and be given one of these in addition to everything to carry around just in case you need it. And the third option, well, the other option is that sometimes you may not be good at taking inhalers when you are having an asthma attack. So this can happen if you're panting, if you're breathing, you're taking only very shallow breaths. You can't really stop your breathing to inhale deeply to synchronize your breathing with the inhaler. Sometimes it can help to have a spacer around. Now, this is of course very bulky. There are others that you can use as well. I think I have one around here. So for example, this is like a little portable one. It looks like a little bottle, but it just collapses. There are different types of spacers that you can find. And these ones, they can be helpful if you are struggling with an asthma attack. You can't really shake it with just taking the medication. The medication doesn't go in properly because it allows you to remove a step. So you just press on the inhaler, you trigger it, and then you inhale from the other end. And you still get more medication than just trying to synchronize. And this goes to the back of your throat. It doesn't go in the lungs as well. So spacers are another option that you can have to carry around if you're going on a trip, if you're going to somewhere new. Just have one in your bag just in case you do get an asthma attack. And the other option would be, obviously this is becoming complicated, but if you have a really, really bad asthma attack, to have some sort of a nebulizer device at home. So where you would generally use a liquid form of salbutamol that you put in the nebulizer, you turn it on, you put the mask on, and you just breathe in and out gently. And that can sometimes help cut an asthma attack if that's the case. So I think that hopefully that covers it. It's a fairly long answer that I gave you, but like I said, asthma attacks are not an easy thing to deal with. So if you are on good control or medication, if you're taking steps to remove allergens, to treat acid reflux, to do all the other lifestyle changes that are required to control the asthma, you'll get less and less asthma attacks. And then you'll only need to use something like this maybe once or twice a week. So that would be a measure of good asthma control. So hopefully this was helpful. If you have further questions, do leave them in the comment section below. All the best and good health.